Welcome everyone to today's New England PTTC webinar, The Future of Tobacco Control, Current Research on Potentially Transformative Policies. Very happy to have today's presenter, Rachel Cassidy, joining us. I'm Kristen Erickson, the Distance Learning Coordinator with the New England PTTC. We are based here in Maine. This event is supported by the New England Prevention Technology Transfer Center, or PTTC, as I just said. We are funded through a cooperative agreement from SAMHSA in the Department of Health and Human Services. The opinions expressed in today's webinar are those of the presenters and do not reflect the official position of DHHS or SAMHSA. The New England PTTC is part of the National PTTC Network. We are one of 10 regional centers working to translate prevention science into trainings and technical assistance to guide the prevention workforce in adopting and implementing prevention science in your communities. We have a wide range of services and products available, including webinars like this one, online courses, in-person events, and a lot of other types of learning communities and online resources. If you haven't checked out our website at pttcnetwork.org, I would encourage you to do so. If you're joining us today from outside of New England, welcome. And here is our PTTC regional map. So if you haven't connected with your regional center, I'd encourage you to reach out to them as well. They may have additional region-specific resources for you, but we are always excited to see folks from in New England and other areas as well in our webinars. Lastly, I wanted to share our note from the PTTC network. We strive to use affirming language to promote the application of evidence-based and culturally informed practices in our work. We know that words have power, and the use of affirming language inspires hope. So we invite you to incorporate this into your own work as well. And that's all I have. So I am going to turn it over now to our speaker for the day. I'm really excited about this topic. I think it'll be really interesting. Our speaker is Rachel Cassidy. She's an associate professor at Brown University's Center for Alcohol and Addiction Studies and the vice chair of the Behavioral and Social Sciences Department in the School of Public Health. She's been a faculty member at Brown since 2014, and her work is focused on adolescent cigarette smoking and the potential for tobacco regulatory policy to impact youth tobacco product use. So that's a bit of what we're going to be hearing about today, and I will turn it over to you, Rachel.
Hi, everyone. Good afternoon and welcome, and thank you so much for joining me today. Yes, Kristen said I'll be talking about tobacco control and some new transformative policies that have the potential to become law. And just before I get started, I don't have any conflicts of interest to disclose. So today we're going to talk about the tobacco endgame and what that means, and with a special emphasis on youth smoking. My work is in youth smoking, and of course, youth are an incredibly important population for tobacco control. So we'll be kind of focusing on youth specifically, and we'll be talking about how we get there. How do we get to a world without tobacco smoking? And two policies that we'll be focusing on. The first one is a menthol ban, which some of you may have heard about in the news, and we'll talk about some evidence that the menthol ban would benefit youth, as well as potential pitfalls for implementing it here in the United States, as it has been already implemented in other countries. And then for the second part, we'll talk about a reduced nicotine standard, which is another policy which I don't think has gotten as much news attention, so it might be new to some of you. So we'll go over what that means. Most of my work has been in this area, and we'll talk about how that would benefit youth and sort of the research that needs to continue in order to make sure that this policy would benefit everyone. So I just want to get us on the same page in terms of remembering that smoking is still a major problem. Smoking is still the #1 cause of preventable death in the United States. It causes more deaths than HIV, overdose, alcohol use, motor vehicle injuries, and toxic agents combined. And I think that sometimes we think that maybe smoking is a solved problem, right? You know, we've made such advances in smoking in tobacco control, which is amazing. But smoking is so dangerous that we have to keep an eye on it. Of people who smoke past the age of 40 and continue to smoke throughout their life, almost 2/3 will die from their smoking habit. So it's serious, and it's something that, no, even if it's getting lower in prevalence, it's still causing this outsized harm for public health. And we're focusing on youth because smoking is often called a pediatric issue. Rarely does someone pick up smoking at, 45 or 50. It's something that happens when you're young. And then nicotine, because it's very addictive, people will continue to smoke as they get older. And by age 26, almost everyone who will start smoking has started smoking. So it's very important that we focus on reducing the number of youth who start smoking. And also, a longitudinal study and a series of meta-analyses have found that if you quit smoking by the time you're 30, you can reduce almost all of the death and disease that is associated with smoking. So even if people do initiate, if we can get people to quit while they're still young, that can really, really lessen the likelihood that they will have any outcomes that are super severe from their smoking. So that's why we're focusing on youth throughout this presentation. So what do we mean when we talk about an end game for tobacco? This paper came out in 2013, so quite a while ago now, but Ken Warner is a really prominent kind of tobacco control scientist, and we were talking about, we made all these strides in reducing tobacco use. We have all these different tools at our disposal, and how can we get to a point where we can see a tobacco-free future, and specifically a smoking-free future? And what we mean by end game is a current smoking prevalence of less than 5%. And currently in the US, we have a smoking prevalence of 11%. Back when this was published, we thought we would be doing worse. So we're doing better than we thought, which is great. But we want to know, how can we get farther along? We've done a lot of the same things for a long time that have worked really well. Marketing restrictions, mass media communications, aimed at youth, taxes, all of these things have been great, but how can we kind of do something really new to kind of push us into these really low levels of smoking that will have such a huge impact on improving public health? So before we get started, you'll notice I'm talking a lot about cigarettes and cigarette smoking rather than all tobacco. And I wanted to make sure we're all on the same page about why that might be. So I had Kristen set up a little poll for me in the Zoom. So the poll is going to ask what the primary cause of death is from tobacco. So when you smoke tobacco, what is it that makes, that will actually cause you to die? Is it toxins in the tobacco plant? Is it exposure to nicotine? Is it inhaling tobacco smoke? Or is it chemicals added to the tobacco products during manufacturing? So go ahead and vote and see what you think, and then we can talk through what the answers are. Great. So it looks like many of you guessed that it was chemicals added to tobacco products during manufacturing. And then there was about equal numbers that thought it was tobacco smoke inhalation or nicotine exposure. And that's actually, I'm glad we did this poll, because the answer is actually tobacco smoke inhalation. That is what causes death from smoking. And I think that surprises a lot of people. There are chemicals added to the tobacco plants during manufacturing, but that's not what causes the harm from them. It's simply inhaling things that are burnt. Inhaling smoke, if anyone's been around a bonfire and you coughing, that kind of thing. Smoke is incredibly bad for us. It causes inflammation. It's full of volatile organic compounds. All of these things cause cancer. And that's actually what causes cancer from smoking, is simply that you're inhaling something burned. So anything that's on fire that goes in your lungs is really dangerous. And I think that is sometimes lost. And marketing companies like American Spirits Tobacco, for example, they often advertise that they don't put chemicals in their cigarettes, and it makes people think they're safer, but they're not, because what's harmful about cigarettes is that they're on fire, and that they're inhaled. And it's important to note that people smoke for the nicotine, right? And we all know that nicotine is what's addictive about cigarettes, but they die from the tar. The tobacco plant itself, the nicotine is encased in this tarry substance. If you've ever been around a nicotine plant, it kind of gets on your hands, and then it coats actually the lungs. And that is what causes that carcinogenic tar, causes lung cancer. Nicotine itself is not carcinogenic. If it was, it wouldn't be allowed to be a medicine. So nicotine replacement therapy, right, is nicotine without being combusted. That's why it's allowed to be considered safe and effective by the FDA. And nicotine itself doesn't cause cardiovascular problems in people who otherwise have no risk. Again, this was why we have nicotine replacement therapy, which is great, because nicotine replacement therapy can help people stop smoking. Another source of toxins from of death from not cigarettes but other types of tobacco are toxins in the tobacco plant itself. That's why if you're using chew or dip and you're holding it in your mouth, even though it's not on fire, the plant itself has toxins and nitrosamines in it, which cause cancer of the mouth. And similarly for cigars, when people hold them in their mouth but they don't inhale, you can get mouth cancer from the actual tobacco plant itself. So if you don't have something that's on fire, so you have something that you're not inhaling into your lungs that's on fire, and you have nicotine from a non-tobacco source, so synthetic nicotine made in a lab, it doesn't contain those nitrosamines, that is a safe form of nicotine. That's what's used in nicotine replacement therapy. So this is just a little graph of, showing that, here we have on the left axis the risk of death. And so combustion is really the main cause of death. So little cigars, pipe, tobacco, anything that's on fire, that's the main cause of harm. And then you have smokeless tobacco, which again contains nitrosamines. And then you have NRT all the way on the end. And so I want to be clear though. You might be saying, Dr. Cassidy, but nicotine is bad. Well, it is bad for youth, especially. Certainly no one who's not using nicotine already should be using nicotine, right? Nicotine should be not something that people are using, but especially youth, because youth are a special population. Youth can have developmental risks from nicotine. So their brains are still developing. So we don't want youth to be doing any sort of nicotine at all. But from a public health perspective, when we're asking why focus on cigarettes for public policy, it's because of the outsized harm from cigarettes themselves. So anything combusted is really our focus because it is so much more harmful. And so that's why when we talk about cigarettes a lot, it doesn't mean we don't care about other tobacco products, especially for youth. We definitely do. We just want to focus on that major driver of harm. Again, youth smoking is at historic lows, which is amazing. The age of smoking initiation is rising. It used to be much younger. It used to be under age 16, but now it's college-aged youth that are initiating smoking. But nonetheless, we've seen major decreases even from 2010. You can see in this graph that smoking prevalence in 18 to 24-year-olds is continuing to decrease. However, the gray and blue lines show those who are at or slightly above the federal poverty level, whereas the orange bar is those who are well above the federal poverty level. This just shows that unfortunately smoking is now concentrated in vulnerable populations. It's concentrated in folks who have lower educational attainment, folks who are in otherwise marginalized populations. And so it's really a contributor now to health disparities because that 11.6% smoking prevalence that we have in the US is not distributed evenly across the population, and it's not distributed evenly among even young adults as well. Often young adults who smoke have other issues going on. They have depression or anxiety, they have family history of risk factors, adverse childhood experiences. So we care about smoking not just for the public health impact because of its specific impact on health disparities. So to reach the end game, we really need bold thinking. Why, if we've done so well, do we need bold thinking? Well, we've done such a good job, but for certain things, we've kind of reached the limit of where we can go. These data are from the Monitoring the Future project. The year is there on the x-axis, and this is showing the percent of 8th, 10th, and 12th graders, that's the green, blue, and red respectively, who say that they see great risk in smoking a pack or more a day. So you can see it's pretty high and it's been pretty level for years. We've done an amazing job, messaging about smoking, as well as the percent disapproval there on the bottom right. Again, very high disapproval of smoking. That's great. That's what we want to see. Actually, the percent seeing great risk, that graph, they asked the same question about heroin use in the Monitoring the Future study, and actually the rates of risk for heroin use is seen as lower even than smoking, which shows that we've done a great job there. But it also shows that, we have very high taxes also on cigarettes. We've kind of gotten to where we can get with these policies that we've had in our toolkit for a long time. How can we move forward to really push through to that end game threshold? Well, one thing we can do is really focus on reducing the number of youth who initiate smoking, right? Like if we can get people not ever start, then that's better than trying to help people quit, right? An ounce of prevention is worth a pound of cure. So we can target the appeal of the product itself. So cigarettes, companies work very hard to make cigarettes appealing to youth and to, they've always tried to do that, and they've been restricted from doing so. They're not allowed to have flavors except for menthol. They're not allowed to, use advertising that has cartoons and things, but there's more that we can do that we can really make the product itself less appealing so that youth don't initiate with those products. And we can do that because the FDA has authority to do that. So in 2009, President Obama signed the Family Smoking Prevention and Tobacco Control Act, and it did a lot of things, but one thing that it did do was allow the FDA to set product standards for cigarettes that manufacturers would have to comply with. And so that was new. We weren't really allowed to do that before in a broad, systematic way. So the work that I do is funded through the FDA to support the evidence base for these types of product standards. We obviously can't just pass a standard and see what happens, because the tobacco companies have the right to sue the FDA, and the FDA needs to prove that what they did with respect to this tobacco regulation met the standard that the FDA has. And the standard that the FDA has is that it's shown to be beneficial for the protection of public health. So they need to show evidence in court that their regulation is good for public health. And that means science. So the first policy I want to talk about is a menthol ban. So again, you may have heard about this in the news. This headline says Biden criticized for failing to ban menthol cigarettes after Trump withdraws the proposal. We got really close in the Biden administration, but ultimately it was not passed. And this just shows that while we're doing the science, regulatory process is actually a political process. So we can continue to go ahead and do our science, but whether or not the regulatory winds can change, very quickly. So we just have to keep moving forward with our science, and things can change on a dime. So why should we ban menthol? Well, specifically youth use menthol quite a lot. So you can see that in the third bar of youth who are using only combustible products, so mostly cigarettes, about 30% of them use menthol cigarettes. And of those who use lots of different types of products, so e-cigarettes and other things, over 50% are using some form of menthol product. So menthol is really popular among youth. Many people who switched to non-menthol cigarettes started with menthol cigarettes because it's, they're less aversive. The cooling sensation kind of masks that harsh smoke that makes you cough. So banning menthol would help reduce youth initiation is the hope. And we actually have a lot of data from other countries, because other countries, including Canada, England, and the EU, have all banned menthol in recent years. So we can look at their experience and try and extrapolate how it might go here in the US. So here on the left, we have the blue dots are us in the US. The orange is England. You can see it most dramatically that after February 2020, they implemented a menthol ban, and you can see the orange dot goes down. That just shows that very few people reported using menthol after the ban. They also had much lower menthol prevalence overall, you can see, than we currently do. And in England, they did see here after the February 2020 ban was passed, by August 2020, their youth populations reported very little menthol smoking. So it showed that it worked in terms of what type of cigarettes that people were smoking went down from menthol. And it doesn't show in this graph whether they were using something else or whether they quit. So let's figure out what actually they did. Well, we have an idea of what they did from a study that I conducted with a mentee. We actually did an experimental marketplace. So we had people choose tobacco products that they might want to use in sort of an online store format. These were menthol smokers, and we wanted to model a situation where they wouldn't have their menthol cigarette available. So in some of the shopping tasks, the shop had their menthol cigarette, and in some, the menthol cigarettes were not available, and we saw what they chose instead. And in situations where menthol was available, the increasing price of the menthol cigarettes represented kind of more difficulty in getting the menthol cigarettes. We wanted to see, as menthol cigarettes became more challenging to get, what will people switch to? And so you can see in the top two panels, here we have the menthol cigarette price is going up, and the amount of menthol cigarettes that were purchased are going down. So if you just look at the green dots, that looks like a supply and demand curve, right? As you increase the price, people buy less of it. Same thing, as we increase the menthol cigarette price, people said, oh, I'm not going to buy that menthol cigarette in this online store. I'm going to buy something else. So when we had menthol little cigars and cigarillos available, so these are things like Black and Mild, Cheyenne, stuff like that, you see this X pattern, right? Where as their menthol cigarette use is going down, they switched to these other combusted products that had menthol still. Similarly, these purple squares show non-menthol cigarettes. So as menthol cigarette use went down, people often switched to non-menthol cigarettes. You see this sort of X pattern that shows substitution. They were substituting their menthol cigarettes for a very close substitute, which is non-menthol cigarettes. And similarly, some people decided to substitute with menthol flavored vape products. So this gave us an idea in an experimental situation of what people would do in the face of a menthol ban. And this is actually what was seen in many of the countries that have implemented this. So these are the menthol ban outcomes in Canada. So you can see the green, they had 7.5% menthol smokers in 2020. 15% of those quit, which is great. That's what we want. However, 81% continued to smoke. They just switched to non-menthol cigarettes. And so that's not exactly what we want. But again, 15% quitting is great. And it shows that we can chip away at that by getting people to by banning menthol, but that we're still going to have to watch out for substitution, and that we really need to support and encourage quitting. So the evidence suggests that a menthol ban would improve the health of young people by making smoking less appealing. Again, it's hard to study initiation, right? Because we can't exactly know, but we know that menthol is appealing. And so if we have only non-menthol cigarettes, we can suggest that young people would probably smoke less, there'll be less initiation. And we did see some quitting. So we can expect that some people would quit if we had a menthol ban. But we need to make sure that we extend it to little cigars and cigarillos as well, because otherwise those are too good of a substitute. People will just switch to those and they won't reduce their harm because they're still combusted, they're still on fire. But we need to be prepared for significant substitution with non-menthol cigarettes. And we really need to focus on supporting quitting and also being aware that illegal sources would be a problem as well. I also didn't mention this as much, but Black Americans would be particularly affected by a menthol ban, as of Black Americans who smoke, around more than 80% smoke menthols. And evidence from other countries has been limited in terms of answering the question of how Black Americans in particular would be affected, because that sort of racial distinction around menthol doesn't exist in other countries. And that's because tobacco countries have been specifically targeting African American communities for decades and decades. And so we have a kind of very distinct profile of a menthol user that is not the case in other countries. So we still have questions about that as well that we'll need to answer before we implement this policy. And if we do implement it, we just need to make sure we're really supporting quitting in those communities as well. So I want to move on to talking about a reduced nicotine standard. So menthol ban, I think a menthol ban is, it makes sense, right? Menthol is the kind of only flavor that's left. Back in the old days, I even remember when there were clove cigarettes and other cigarettes that had flavors that were more popular among youth, and the Family Smoking and Tobacco Prevention Act did ban all flavors except menthol. So menthol's been kind of this last bastion of something that makes cigarettes a little bit more appealing, a little bit more easy to use for young people. So this standard, though, the reduced nicotine standard, I think might be new for people. So the reduced nicotine standard is what it sounds like. So because the FDA has this broad authority to set product standards, the FDA can actually mandate that cigarette manufacturers manufacture their cigarettes such that they only contain a very trace amount of nicotine. So not zero, but very low amounts. This is different from a light cigarette. Light cigarettes are just regular cigarettes with holes poked in the filter. So if you just close the holes with your hands, like most people do when they smoke a cigarette, you can get, it's just a normal cigarette. And if you smoke 2 light cigarettes, it's like the same as smoking a regular cigarette. Reduced nicotine cigarettes, it's not the case. The tobacco plant is actually bred to have very little nicotine in it. And then they make the cigarettes out of that tobacco plant. And so even if you smoked a bunch of very low nicotine content cigarettes, it's like drinking a bunch of decaf coffee or a bunch of non-alcoholic beer. You just can't get that buzz. That doesn't mean you won't feel anything. Some people feel that they feel a little looser when they have a non-alcoholic beer, or feel a little better if they have decaf coffee. But there's no, there's trace amounts, just like there's trace amounts of caffeine or trace amounts of alcohol, but not enough to be behaviorally active. So this press release is from January 15th of this year. So this was very recent. I just wanted to show that this actually could happen. So the FDA is fairly far along in the regulatory process for this rule. things changed on January 20th, and so this has been stalled. But actually, it could, it could become law. So I just wanted to point out that it's possible that, this could happen. And so why would we want to do this? Well, nicotine is what's addictive, right? So if we take out what's addictive, if people smoke for the nicotine and die from the tar, well, let's take out the nicotine and people will maybe smoke less. Now, this is an empirical question, right? We needed to do studies to see if this was true. And there have been many clinical trials done with adults that have shown that, in fact, this is the case. So when you ask people who smoke to switch to these very low nicotine content cigarettes, they reduce their smoking, which makes a lot of sense. They're not getting nicotine. But what about youth? Young people are different from adults, right? They have a shorter smoking history. And that's important because when you drink decaf coffee, for example, you have all of these associations of real coffee, right? So just the smell and the taste might kind of reduce if you have a caffeine headache, because of all these pairings, right? This is like a Pavlovian association that we have. It's not something we do consciously. It's from being paired over so long with that active ingredient, with that primary reinforcer. And so even though there's no nicotine and people do reduce their cigarette consumption, it's not like it immediately goes to zero. It takes time for those cues to sort of extinguish. But youth are different. They have a shorter history and they're less influenced by nicotine per se because they're just not as dependent yet on nicotine as adults because they haven't been smoking for as long. They tend to be lighter and more intermittent smokers to begin with. So the question was, will youth respond as well as adults? Will they respond worse or better? And so that was been the focus of my research program for the last decade. So I'm going to go through an overview of just a couple of studies that I conducted in youth. So I conducted a 3-week trial in adolescents, so 15 to 19-year-olds were the age group for that study, where we were looking at what the effects would be if we asked youth who already smoke to switch to very low nicotine cigarettes for 3 weeks. And I also looked at within a larger trial, so if folks were over 18, they could be in this large trial of very low nicotine content cigarettes. What about if we could look at the subgroup of 18 to 24-year-olds, that important group that I've been referencing, relative to the older adults in the same trial? So we could kind of see, are young adults responding differently, better, worse, the same? And for the very low nicotine content cigarettes, we'll call them VLNCs. And these cigarettes are actually made by the government for our studies, and they're not very good, and they're not because they're not made by a tobacco company. And so instead of the control cigarette being their kind of usual brand cigarette, the control cigarette is actually what we call a normal nicotine content cigarette. So it's a research cigarette that just has regular levels of nicotine, but that controls for the fact that the cigarettes are, again, they're just made for the studies. They're not branded. They're not, they're not made to be particularly good. So this study is a lot. It's just to show that we had participants in the laboratory smoking cigarettes, so we could ask them about their reactions to the cigarette, look at abuse liability. So abuse liability gives us a hint as to what people who would do when exposed to the cigarette for the very first time. So new initiates of cigarette smoking, that's obviously unethical to do, to expose a youth to a cigarette who's never smoked before. But from this type of data, we can get an inkling. If people are telling us, oh, I really like these just the same as my usual brand, that means that the abuse liability would be high. But if they're saying, no, I don't really like these aren't very good, that's low abuse liability, and that's good. That's what we want. So for this study, we had the average age was around 18, a little over 18, and about 45% menthol smokers, and they smoked about 8 cigarettes a day. So these are relatively heavy smoking youth in this study. So what we found is that after 3 weeks, you can see there the open squares are the folks in the VLNC group, the low nicotine content group, and you can see that they reduce their smoking relative to the normal nicotine content group. And both groups actually reduced their, this is a biomarker of how much nicotine they had. So actually both groups reduced their nicotine, again, because those research cigarettes aren't very good, but the valency group had a larger percent decrease from baseline. And I wanted to put this up here. This is the seminal study of very low nicotine content cigarettes in adults that was published in the New England Journal of Medicine in 2015. I actually worked on this study as a postdoc when I got to Brown. And so I think this is striking because you can see we really found almost the same exact thing in youth. Obviously, the level of smoking is different because they're smoking less because they're youth, but this was a really cool replication that showed that, we can show this decrease in smoking as a function of being switched to very low nicotine content cigarettes. Again, they're not quitting, but they're reducing their smoking over time. That process is starting to happen of extinguishing those cues. And again, this is out in the real world. So we're saying, please don't use any other of your normal cigarettes, but people did, because this is a clinical trial, people are doing other things. But even nonetheless, even in that kind of environment where people have access to a lot of other things, they still showed this decrease in smoking. So over time, we saw that VLNC exposure reduced smoking, which is great. And we did see that reduced abuse liability, the lower reinforcement. They didn't like the very low nicotine content cigarettes, and that's good. It shows that, we don't want these cigarettes to be equally as appealing. But we did see that people were using other sources of nicotine. This happened in adults, it happened in youth because, again, we just can't control everything that people do. But it's also a really important clue to the idea that people still want nicotine. It seems like they're willing to maybe switch away from cigarettes, but not everyone is really willing to give up nicotine. So it gives us a good hint that people are still searching out other forms of nicotine. And so we should make sure that we can fill that gap with safer sources of nicotine, like nicotine replacement therapy. Because they didn't like the cigarettes at all, even the folks in the normal nicotine content group didn't like the cigarettes at all. That kind of complicates the picture for youth. Adolescents are very drawn by branding and that kind of thing, less so by nicotine, like we talked about. So that makes things a little bit complicated for youth, but we still saw this signal that adolescents would benefit from this policy. So next, I wanted to look at directly comparing young adults to older adults in the same study. So this study is the 2015 study that I just showed the outcome graph from, that I worked on as a postdoc. And so this was the same type of thing. People were asked to switch to their very low nicotine content cigarettes or a control cigarette for 6 weeks. And I looked at the subgroup of 18 to 24-year-olds and compared them to the older adults in the study after 2 weeks of exposure. So we wanted to see if they would respond differently or similarly to older adults. And what we found was that we're looking here at the top left panel, the very lowest nicotine content groups. You can see that the black bar of 18 to 24-year-olds is lower than the gray bar of older adults on smoking satisfaction. And they're both lower than usual brands. So basically both young and older adults were like, yeah, I don't like these cigarettes, but the young adults liked them even less. They actually were even less reinforced by them than older adults. That was true for also the psychological reward measure as well after 2 weeks. And then after 6 weeks, the older adults started to come down to be more like the young adults. Their kind of any liking of the cigarettes started to decrease for them as well. So that significant difference went away, but you can still see that they're both very low. And that actually also translated to differences in smoking. So if we look here at week 2, again, in this group that had the very low nicotine content cigarettes, the 18 to 24-year-olds here in the black smoked fewer cigarettes than the older adults, even controlling for their baseline level of smoking fewer cigarettes. So they liked the cigarettes even less than older adults, and then that translated them into smoking even fewer of them than older adults. And so that's great because it suggests that if we did pass a reduced nicotine content standard, that it would reduce the abuse liability of cigarettes, that would reduce initiation, hopefully. And these data show that young adults might even show a better effect because they liked these cigarettes even less. They had an even lower abuse liability and even lower use of VLNC cigarettes in the context of our study than older adults. So that was a really promising finding. But before we get ahead of ourselves, I think it's clear that there's a lot of potential pitfalls and areas for future work as well. No one has yet implemented this policy. New Zealand came very close. They were planning to implement this policy as part of their smoke-free 2025 plan, but their government decided to go a different direction at the last minute. That would have been implemented last year. So we're still at the theoretical stage. We don't have, like we do for a menthol ban, kind of other countries to look at. One thing that I'm concerned about, and what we found in my data, is that we don't want people to think that these cigarettes are safer. A lot of people think that nicotine is what causes harm from cigarettes. We don't want them to hear that, oh, there's no nicotine in these cigarettes, they're safer. They're not, right? We know that combustion is the driver of harm. What they are is less addictive. And that's kind of a nuanced message. They're less addictive, but they're still harmful. It's hard. And in this study, the studies that I mentioned, they were double blind. So we didn't give them any information about the cigarettes. They didn't know whether they were given low nicotine or normal nicotine cigarettes. And we had them smoke the cigarettes and then answer questions about their risk for disease. So they're responding only to something about the cigarette itself, not any information that we've given them. And even under those situations, the participants in the VLNC group that had the lower nicotine content reported that their risk for developing diseases would be less, which is not ideal, right? That's not true. And so the concern is that this policy could lead to lowering those cigarette health risk perceptions, which are very high. We want to keep them high. We don't want to lower them. And so that means we really need to think about health communication. We need to think about how to message this policy so that people understand what the purpose is, that these cigarettes are less addictive, but they're still, harmful. We also did qualitative work in some of our studies. This was a study that I didn't speak about the results of, but what you should know is just that these were, again, adolescents in the lab who were exposed to either very low nicotine content or normal nicotine content cigarettes. And we asked them, okay, imagine that your study cigarette that you've had is the only cigarette that's available to you because there's this new policy that there's a very low nicotine content policy in place. And so we're seeing that some participants reported, wherever the nicotine is, I'll go there. I'd probably just do Juul again, or I would definitely use those nicotine pack pouches that you put under the lip. I think those are called Zyn, and also hookah. And so that's obviously not what we want. We want young people to quit. Obviously, even though those are less harmful than smoking, for youth, again, we'd prefer that they use, if they're using anything at all, to be using the, nicotine replacement or just quitting completely. So it shows that we really need to support folks in order to make this policy have the maximum benefit. And there was also a number of other issues brought up about, for example, someone feeling like they're just light cigarettes, that you can just smoke a bunch of them and it will undermine the policy. And as I mentioned, that's not true, but a lot of people might think that. So we need to make sure that we're messaging about that. As well as, nicotine's not the only reason to smoke. I've someone saying, it's also the kind of ritual of going outside and, lighting up a cigarette. So there was a lot of really important things that we learned from the qualitative data that points to areas that we need to message around. And this is so important. If we were to just roll this policy out without great messaging, that would really undermine it. People would maybe not understand the point of it. And that could actually lead to, people thinking they're safer, or people thinking that if they just smoke enough of them, that they'll still get that nicotine buzz, and that would be really bad. Even though that doesn't happen and no evidence has shown that it does happen, what I'm talking about is compensating, so smoking a bunch. We did not find that in any of our studies. And it's actually never been found in any of the studies that have been done. And there's been 15 or 20 clinical trials probably at this point of many different populations. That has not been found, again, because it just doesn't work. So even if people try it, it doesn't work. However, you don't want people to start there. You don't want people to start with the idea that it could work and go from there. We want to make sure that people understand that that's not the case. And similarly, in another study, the 3-week study that I referenced earlier, some participants in that study did report that they probably would quit, which is great. But other people, again, stated that they would probably just use another thing like an e-cigarette, or smoke more cigars than cigarettes. That's obviously something we don't want. That's still combusted tobacco product. We don't want people doing that either. So this points to concerns about other tobacco product use. As we know, adolescents commonly use other tobacco products, and adolescents who smoke often use other things like e-cigarettes. In our previous studies that I just went over, we excluded folks who used other products at high rates because we were looking at nicotine biomarkers and we wanted to kind of keep those as clean as possible. However, for this study, we explicitly included folks who used at least one other product because we wanted to see if they would be at high risk to switch to other products. If you're already using a Juul and smoking suddenly becomes less exciting because there's no nicotine in it, that might mean that you increase your use of Juul or use of your e-cigarette. So in this study, we switched them to either very low nicotine content or normal nicotine content cigarettes for 4 weeks. Again, this was 15 to 20-year-olds for this. So there was a similar population of around 18 was the average of the folks that we enrolled. And we also conducted among these folks a similar experimental tobacco marketplace to the menthol study that I mentioned before. So again, we were looking at modeling what they would switch to in this little marketplace that we had, because now they actually have experience with the cigarettes. So these are what the experimental cigarettes look like. Again, they're from the government. They're not very exciting looking, but now people have experience with them. So we can model a situation where only these cigarettes, these low nicotine content cigarettes, are available, and see whether what they switch to. And what we found was that as we increased the price of the study cigarettes, they did decrease their use of the study cigarettes, but you can see that unlike in the menthol graphs I showed with that kind of X pattern, we don't see that here. We didn't have as much substitution. We have a little bit here with little cigars and cigarillos, so that's a concern, right? We don't want people to dramatically increase their use of little cigars and cigarillos, but we didn't see very much substitution like we saw in the menthol study, which is good. We don't want to see substitution. However, the study did point out some important things. I want to point out that we had nicotine replacement therapy as an option in the experimental marketplace, but the numbers were so low, it's hard to even see on the graph because youth do not use NRT, and this is a problem. You know, we need to support them quitting, and obviously behavioral options are great, and behavioral options exist. But for those youth who may be smoking at a level high enough that they need, you know, they're going to experience significant withdrawal, we want to make sure that they're turning to nicotine replacement and not to something like an e-cigarette. And the Truth Initiative actually just recently announced that they were partnering with Blip, which is a company that is an FDA-approved nicotine replacement therapy company that's actually focused on young adults. So their marketing and products are really aimed at young adults. This is their website. So it has the quit kit. They can, instead of calling them lozenges, they call them lozies, you know, so they're kind of really trying to make it cool and interesting for young adults. I think this is great because, you know, again, we want young adults to be turning to these FDA approved medications, and rather than just Zyn or things that are not FDA approved medications for smoking cessation. And unfortunately, we did see that VLNCs were still purchased at high prices. We don't want that either. So we need to think about why that is. And we need to think about with these folks who are using multiple products, that process of those cues kind of extinguishing over time because you're not getting the primary reinforcer. You're going to disrupt that process if you're continuing to have nicotine on board, you know, from your Juul or from your Zyn product. It's going to disrupt that. So it makes sense that their process for extinguishing the cues associated with smoking was disrupted. So they kind of were still using those VLNCs at a higher rate than we wanted compared to folks who were just smoking. And combustible products were the most commonly purchased alternative, much like we saw in the menthol study. Even though it wasn't at high rates, we don't want that to happen at all because that's just going to undermine the public health benefit. And luckily, the FDA did propose that if they were going to set a reduced nicotine standard for cigarettes, they would extend it to little cigars and cigarillos. So that's great. So that wouldn't be an option for substitution because that they would also be subject to the nicotine reduction policy. So overall, I think what we've found in our research program is that we really need careful messaging about this policy. We need to do really high quality health communication research to understand different populations, and particularly youth, how they would react to this policy, how we can convince them that it's a good idea, and how we can try and correct any misperceptions that folks may have about what nicotine is and does, as well as at the same time, you know, as we're trying to shift people away from cigarettes, shift them towards quitting, shift them towards nicotine replacement therapy if they're not ready to fully quit nicotine, and under, you know, kind of encouraging NRT use. And it's good to see the Truth Initiative and others starting to do that as well. And same thing with flavor bans like a menthol ban. We have to carefully think about that, and we have to think about, make sure that it's extended to all the products that are combusted so that people can't switch to something that's just as harmful. And in that case as well, because we have so many people switching to non-menthol cigarettes, we want to make sure that cessation is encouraged at the same time. We want to be providing that support to people. We want to be making sure while we're taking something away, we're providing a safer alternative in the form of FDA-approved nicotine replacement therapy that people can use. And actually, in the New England Journal of Medicine a couple of years ago, because as I mentioned, there's been many, many clinical trials now of the reduced nicotine policy. I think there's, like I said, been 10, 15, a bunch of clinical trials. And so that allowed this group to do some computer simulation modeling, very fancy, very complicated. But what they did was take all the estimates of effect sizes from all these different clinical trials and try and see, okay, what would be the effect, the net effect of this policy based on these estimates if we implemented it? And what they found, if you look at the top left panel, that's looking at prevalence of cigarette smoking. So the blue dashed line is if we didn't do anything. So if we didn't do anything, probably cigarette smoking would continue to fall and then probably level out. And then the gray, the width of the gray bar is the kind of best and worst case scenario range of the policy. So most optimistic and least optimistic, with the mean black line there in the middle. So you can see that under all scenarios, implementing a reduced nicotine standard would reduce cigarette smoking pretty dramatically. In the median scenario, by 2040, we'd have about 2% cigarette smoking prevalence. So that's would be great. And in terms of other tobacco use, if you look at the top right panel, we would see an increase in non-combusted tobacco use, right? There are still going to be people who don't want to quit using nicotine. And we don't want a prohibition scenario. We don't want to, recreate prohibition like in the 20s where there was all of a sudden no alcohol at all that was available and people were using really dangerous forms of alcohol. We don't necessarily want to prohibit nicotine at all. We want to prohibit the most harmful form. And this non-combusted tobacco use would include things like nicotine replacement therapy. So we want to make sure that, there's forms of nicotine available that people can use. They're just not nearly so harmful as smoking. And these simulations showed that we would see an increase, but that it would be modest and it would probably level out as well. This is again based on the clinical trials that have been conducted. So overall, this report found that this would be hugely beneficial for public health, even in the least optimistic scenarios. So the transformative new policies, like we've talked about, are really a new frontier. They can really get us even closer to the tobacco endgame so that future generations aren't plagued by the scourge of tobacco-related death and disease. I know I've had people in my life who've died because of tobacco use, and unfortunately, many Americans have been touched by tobacco use because it's so prevalent. And we can see a future where that's not the case, where these policies are in place and things are different, that cigarettes don't have nicotine in them, so no one uses them, that there's not menthol, so cigarettes are really unpleasant. And we can see that, it's really, really far less prevalent than it is now, and therefore not a significant cause of death. At the same time, important questions remain to be answered. These policies may have those unintended consequences that we talked about. We need to do more research in order to maximize the public health benefits. So when we roll these policies out, that we get it right the first time and that our science is solid so that we can defend against attacks from the tobacco industry in the courts and in the media as well. So thank you so much for your attention. Again, my name is Rachel Cassidy, and I'm happy to answer any questions. I really appreciate your attention.
Okay, great. Thank you so much. That was really, so much data and just different kind of policy that I know was kind of new to me, and I hopefully either new or interesting to folks listening here today. But the question from David in the chat, vape brands such as Elf bars have avoided lawsuits by changing their product and branding for years. Are there any concerns that if or when these policies are enforced, that companies will find a way to keep maintaining the addictive component to smoking or vaping?
Yes, great question. And the answer is, probably yes, right? The tobacco company has so much money, and it's always, we're always two steps behind. When we banned, flavors and Juul because disposable e-cigarettes were not popular. All of a sudden you had the rise of Puff Bar and things like that. So it's very much whack-a-mole. And so, yes, so we, that was why there were already grants in place trying to look at New Zealand's experience to see what the tobacco companies did there to try and fend against that. Unfortunately, again, New Zealand decided not to pass the policy. But yes, that's something that we're definitely going to be looking at, is trying to figure out if there's other things they could put into their cigarettes to maintain some addiction. The likeliest thing I think that they would do, though, is just heavily promote their other products, because most of these products, like in, and e-cigarettes are owned by tobacco companies, the same tobacco companies that own cigarettes, so it's very likely that they would heavily push those products and potentially make them more dangerous. Right now they're less harmful than smoking, but they could change that. They could heavily increase the nicotine in them. They could do a lot of things, and we don't want that to happen.
And another question, just asking to kind of reiterate, I think, kind of those last kind of two last key points
Sure.
for
Yeah, I can actually
folks.
just go back as well. So, well, maybe I can't. There we go. So, I think in the solution is that a reduced nicotine policy standard, reduced nicotine content standard for all combustible products and a menthol ban in conjunction would definitely lead to an increase in benefits for public health. It would lead to a decrease in smoking, and it would lead to lives being saved, many lives being saved. However, we just need to make sure that we maximize that benefit. As I showed in this, where there's a big wide gray band of most optimistic to least optimistic, we want to make it most effective. We want to push it to the most effective, that most effective, most optimistic policy scenario by making sure we roll it out well, that we can really message these policies well and maximize the benefit that way.
Thank you. And there was a question in the chat also. Do you know where somebody might be able to find an updated breakdown of the chemicals that are in e-cigarettes or
Yes, so
cigarettes, combustible,
yes,
either one?
I would normally say the CDC. I'm not sure exactly which what links are still working for the CDC. But that is a great resource, as well as the Truth Initiative's website as well. They have breakdowns on the different chemicals. Many of the chemicals in cigarettes, again, are just in cigarette smoke, for example, is not you know, because it's added. So like formaldehyde and stuff is in cigarette smoke, and it's not that they add formaldehyde, it's just that that's a natural byproduct of setting something on fire. But e-cigarettes typically contain liquid nicotine, usually not from a tobacco source, and then propylene glycol, which is what makes the vapor. It's the same thing that's in like a fog machine, and then vegetable glycerin, which carries the flavor. So that's primarily what's in e-cigarettes.
Great, thank you. All right. Well, we are just about at our time. And thank you so much, Dr. Cassidy. This was super interesting. And we will all stay tuned to see how these regulations and policies move forward, and look forward to seeing more of your research unfold in this topic too. So thank you so much for sharing with us. And thank you everyone for joining us this afternoon.
Thank you all so much. I hope you have a great rest of your day.